So why can't you get the same volume in your breast with breast fat grafting as you can with an implant? Well, let me just explain that. So here's a breast. We're looking at it from the side. This is the pectoralis major muscle. And so, the implant can go under or above or whatever, but let's say we're putting the implant under the muscle. Well, we actually cut the muscle at this lower part, and that allows that muscle to be able to move upwards, and then we're able to put an implant in. Let's say we're going under the muscle. So then we're able to put an implant in that's going to enhance the breast by this volume. Now, the muscle is not going to be in that same location. Obviously, when the implant is underneath, the muscle is now not in that spot. The muscle is now over here. So it's about there. So like this. So that muscle will stretch, and that'll allow, and the breast will stretch, and it'll allow for the implant to come in. But if we're doing fat grafting to the breast, we can't put that same volume in. The implant has some structure to it, and it'll go in and it'll stretch if the tissue will allow it. That's what really determines the implant size. One of the factors anyway is how much that tissue will move and how much that tissue will stretch. But with fat, you can't do that, where you have to put the fat into the breast fat itself, not actually into even the breast tissue. If we look at, so many pens, I don't know which way I'm going here. If we look at, let's say that this is a fat cell. These are fat cells that are in here, and that's naturally in your body. So that's a fat cell. And then remember, with breast, it's a combination of breast tissue along with interdigitating fat. So this is actually breast tissue, and this is actually quite firm, the breast tissue. So you couldn't take a cannula and inject it into the breast tissue. It has to go into the soft bed of the fat. So when let's say the fat is green. So what you're going to be doing is you're going to be putting fat in here, and they're small cells, and we're going to be putting fat in all around these little spaces. And what that's going to do is that's going to stay there, and then it's going to have a new blood supply that will come in and feed these little areas, and so these fat cells can survive. So that's why you just can't put the same amount of volume with fat as you can when you're fat grafting to the breast as you can with an implant. And you can get there. I tell patients we can get there. You can have what looks like a good augmentation with fat. It's just that we most likely won't get there with one time, because with an implant, if you look at the average size of an implant in the United States anyway, Italy, it's smaller, but in the United States it's 375 cc's, which is the same as milliliters, okay, which is essentially like a can of Coke. A can of Coke is 354 ml. So, that's the typical implant size. But when we look at how much of this fat that we can put in here and how much fat we're usually transferring, that's much different. So we're not transferring an average of 375 cc's. We're only transferring maybe 50 to 125 cc's of fat. So if we look at this can of Coke, we're talking about something like that. So we can fill up the can of Coke with fat, but it just takes a few sessions to be able to do that, because the fat has to go in, it has to then survive, and the way it survives by getting a blood supply. Once that all gets established, and I like to wait a few months in between fat grafting sessions, and I like to wait a few months for that blood supply to establish, and then we go back in, and then I put more fat in that area. So that's how we can eventually, start getting up there in terms of volume, but it has to be done, spaced it out and allow all of that fat to survive and get a blood supply. So that's why you can't just have 400 cc implant. I don't want an implant, let me get 400 cc's of fat. That's why it just doesn't work that way.